I think this is going to sound probably pretty basic, but so much of it comes back to like knowing ourselves, like exactly knowing what are those hot spots, what are those triggers that get us in a stress state, and then what are our soothers, and being really kind of tuned into what those are. So like for me, mindfulness is huge. I'm a really big fan of third wave CBT, so ACT, acceptance commitment therapy.
Mm-hmm.
And I do a lot of mindfulness on the go. Like I mentioned earlier, if I were to try and do a meditation, it would be actually really aggravating because my ADHD brain would not like that. But I do a ton of tagging of like, okay, this script is playing right now. Okay, that happened and that activated this. That sort of self-attunement, self-validation as you're experiencing hot moments, I think is one of the most powerful ways to organize our mood, because we're narrating, like, here's what's happening. And then it gives us agency back of, and what am I going to do about it? Maybe I have some sensory soothers with me. Maybe I have some earbuds and some music, and I can distract and ground through the sensory experience of music. But I think a lot of it starts with knowing self, and then that ability to be a good self-narrator of our experience.
And also planning breaks. A lot of the
Mm-hmm.
times we think about when students have accommodations, so they may have in their IEP or 504, you have break time, you have bathroom time, but then those things kind of disappear when you grow up. Your body still needs to get those break times. So
Yeah.
think about like that. Okay, I'm going to plan to go to the bathroom. So many times my patients be like, I just went the whole day and I didn't even go to the bathroom, and they
Mm-hmm.
weren't listening to their bodies, and their bodies were saying, I have to go to the bathroom, but they were just working right through it, invalidating how they felt.
Mm-hmm.
So plan the time for taking a break,